Did you know that what you do in private could be making a huge impact on your prostate health after age 60? Whether interested, concerned, or just curious, today we're uncovering the 8 surprising things that happen to your prostate when you masturbate over the age of 60. Stay tuned to discover what every man over 60 needs to know. As men get older, the body changes in different ways, and the prostate is no exception. For most seniors, masturbation-related questions about sexual health and activity will feel taboo or uncomfortable to ask. But understanding how these activities affect your prostate is key to protecting overall health and wellness. In this video, we're talking about the 6 most critical things your prostate can do when you're over 60 years old and masturbating. From benefits you might anticipate to risks you need to know, we're spelling it all out to help you make informed decisions about your health. Let's begin. Number 1. Increased blood supply to the prostate. One of the best benefits of masturbation for men over 60 years is its potential to increase blood supply to the pelvic region. The prostate gland relies on proper blood supply to work efficiently, and with age, circulation can be hampered due to reasons like sedentary lifestyle, cardiovascular illness, or hormonal imbalance. Masturbation stimulates the pelvic area, enhancing blood supply to the prostate. This increased flow will help maintain prostate health by delivering essential nutrients and oxygen to the gland. Increased blood flow might also reduce the chances of inflammation, a condition many aging men are afflicted with. But one needs to make sure that there's always moderation. Masturbation too much can cause overstimulation, and this may become uncomfortable or place stress in the pelvic area. Balance is therefore crucial to enjoy the benefits without abusing the action. Number 2. Lower prostate cancer risk. Several studies have reported an association between high-frequency sexual activity, including masturbation, and a decreased risk of prostate cancer. It is hypothesized that ejaculation gets rid of toxins and potentially poisonous materials that would accumulate in the prostate gland throughout the years. This could be particularly beneficial in men 60 years and older, since the possibility of prostate cancer increases with advancing age. Even though research is ongoing and not yet finished, some evidence indicates that more frequently ejaculating men, approximately 21 times a month, have lower prostate cancer risk than those who ejaculate less often. Masturbation as a way to obtain this rate of frequency, especially for older individuals who do not have frequent sexual partners, may be safe and available. Number 3. Balance of hormones and relief from stress. Masturbation also releases oxytocin and endorphins, which are referred to as feel-good hormones. These medications can reduce tension, improve mood, and induce relaxation. Stress control in men over the age of 60 years is necessary, as long-term stress can negatively impact prostate health by causing inflammation or hormonal imbalance. In addition, masturbation can also control testosterone levels. Since testosterone diminishes normally as one gets older, there needs to be equilibrium maintained to preserve prostate wellness and overall wellness. With controlled sex, the elderly can maintain their hormonal health, and that's good for the prostate. Number 4. Prostate congestion risk. Conversely, too much masturbation can result in a condition called prostate congestion. This happens when the prostate gland becomes full of fluid from repeated stimulation without proper drainage. Prostate congestion symptoms may range from pelvic pain, urinary trouble, or the sensation of weight in the lower abdomen. For men over 60, it's critical to think about how often they masturbate. Too much masturbation puts a strain on the prostate and may even exacerbate pre-existing conditions such as benign prostatic hyperplasia (BPH). This is a common condition in older men where the prostate gland becomes enlarged and squeezes the urethra. If you experience any pain or discomfort, or if you have urinary issues, then you need to visit a doctor. 5. Impact on benign prostatic hyperplasia (BPH). Benign prostatic hyperplasia, or BPH, is an enlargement of the prostate that is benign and strikes most men past the age of 60. Symptoms and signs include urination too often, difficulty starting urination and terminating urination, and a diminished urine stream. Masturbation in itself does not trigger BPH, but can influence symptoms depending on frequency and intensity. Light masturbation can ease pressure on the prostate by providing normal ejaculation, which can help to decongest fluid. Too much sex, on the other hand, may infuriate the gland and exacerbate symptoms. If you have BPH, be attentive to how your body responds to masturbation and make adjustments accordingly. 6. Emotional and psychological benefits. Aside from physical changes, masturbation also has the capability to deeply affect mental and emotional health. For the majority of elderly people, sexual prowess is crucial for them to feel young and confident. Masturbation can be a safe way of sexual release, especially in individuals who lack a partner or find it hard to perform sexually due to age. Also, the act of masturbation can be employed to combat loneliness or depression, which are common among older individuals. Through the development of a healthy relationship with their bodies, men over 60 years can improve the quality of their lives, indirectly promoting prostate health by reducing stress and feeling good. 7. Potential for muscle strengthening. Here's one advantage you might not have considered: muscle strengthening. The pelvic floor muscles that also support the prostate and bladder can be strengthened by the contractions that occur during ejaculation. In older men, this can translate to improved urinary control and a reduced likelihood of developing issues like incontinence. Think of masturbation as a means of exercising your pelvic floor, another reason to keep it in your health routine. 8. Risk of overstimulation and fatigue. Finally, a note about overstimulation. As great as masturbation is, too much masturbation can lead to physical exhaustion and prostate strain. For men in their 60s and beyond, whose bodies don't rebound quite so easily as in earlier years, excessive masturbation can result in pelvic soreness or even pain. The solution: moderation. Listen to your body and don't overdo it. Masturbation at the age of over 60 is a matter that should be discussed frankly and openly. While it may give various prostate health advantages such as improved blood circulation, endocrine balance, and potential reduction of cancer threats, it must be done with the proper amount of moderation and your body's sensitivity. Excess of it would lead to various health issues such as clogged prostate or worsened disease like BPH, so making a good moderation is necessary. If you are worried about your prostate or how masturbation is affecting you, don't hesitate to speak with a healthcare professional about this. Checkups, healthy living, and education are the best means to support your prostate and overall health as you grow older. Remember, taking care of your body is a constant process, and the awareness of these changes is a large component of it. This thorough summary should prove informative for older men who wish to learn more about the relationship between masturbation and prostate health after age 60 by keeping yourself informed and taking action. You can make decisions that favor your health and well-being during your golden years. With that said, thanks for watching, and until next time.